Ricardo Espinosa came to see us 7 months ago, and he came to us with a similar problem that many people do, and that was failing teeth. He was in a situation where his teeth were not working for him. He was in pain, he couldn't chew, he had no confidence, and he was looking for a solution.
When I used to go seriously for my dinner, because I love to go there, I started eating, I get so embarrassed.
He had something which was removable. He couldn't enjoy his food. His bone and gums were shrinking all the time, and he really wasn't enjoying his life as much as he could have. Patients with dentures struggle chewing because food does form a big part of your life. Holidays, big part of your life, and everything is centered around food.
I stopped eating again, clean up in the bathroom, come back. I almost lost my denture. That night, it was like a nightmare. Oof.
Now, Ricardo had been to see several groups of dentists, and all of them had told him that there was no solution, and he was stuck with dentures for the rest of his life. And this was a thought which really wasn't too appealing to him. Dentures really are, biomechanically, it's an inferior type of prosthesis. And a lot of these patients, they suffer from digestive problems, and they're on a lot of medications for gastrointestinal disturbances. The reality is that these two pieces of plastic move in your mouth, and when you have teeth moving in your mouth, you can't enjoy the taste of food. You lose the taste. You can't taste your coffee anymore. You can't enjoy the temperature of a warm pizza at the roof of your mouth. There are so many disadvantages to wearing dentures. Now, when he came to us through diagnostic imaging, CT scans, and a proper examination, we deemed that providing Ricardo literally teeth that very same day was a proposition, and he really could benefit from such a service. The mechanics of what we're doing is we're essentially placing artificial tooth roots, which are dental implants, and then we're connecting fixed permanent teeth on top of that. What that allows him to do, that allows him to have the confidence to bite, chew, without being worried that these teeth are going to fall out, they're going to move. The procedure happens in one day, but the diagnostic appointments prior to the fact take about 2 or 3 visits to the dentist. So when you first come in, what we're going to be doing is we're going to be making impressions. The second visit, we're going to be recording your bite, and the third visit, we're going to give you a cosmetic preview in regards to what you're actually going to look like, and we utilize digital technology to be able to do that. Now, once we've got your approval, we're going to take a CAT scan. The purpose of the CAT scan is to give us the 3-dimensional topography of the bone so that we can plan the surgery outside of your mouth. Now, come to the surgery day. The surgery usually takes about an hour and a half per jaw. The implants are placed very minimally invasively. And after that, we go ahead and we fix the permanent teeth to the implants. So literally that very same day, you walk in the morning without teeth. Later in that morning, you leave with fixed permanent teeth. The moment that he felt that his teeth were not moving, it was a dramatic change for him. And he almost had tears in his eyes to the fact that he regained almost his youth back, because he had teeth which no longer moved anymore. So we gave Ricardo about 4 to 5 months to heal. And the reason for the healing is that the gum shrinks, and we're trying to work out the cosmetics, the bite, and many other things in the temporary teeth. Typically, when patients have this type of treatment done, they obviously don't want anybody to know that they've had anything done. So what we try to do is we try to give them very natural looking results. Now, once they leave the dental environment and they go into their own environment and they're interacting with friends and family, and once again, the change is dramatic. I've had friends and family members of Ricardo's call me and tell me how he's changed, how he's more confident, how he's more talkative, whereas before he was a little bit quieter, a little bit subdued. And what's changed in his life? His teeth have changed. Now, the day we delivered those final restorations, once again, Ricardo could not believe what we had done. A man who had come to us 7-8 months ago with no hope, no smile, and a really distraught look in his eyes. Today he's smiling, he's got a smile not just in his teeth, but he's smiling with his eyes.
That I had the freedom to sit on my table and eat whatever I wanted to eat with no one problem at all. Happy like you cannot have idea.
Most people don't realize the impact good functioning teeth make to your life, and Ricardo is a prime example of what really can be achieved with hope, planning, and some skill in delivering teeth which are natural looking and permanent.
Thank you, doctor, for life, for the rest of my life. So happy.
And it really comforts me that we're able to offer this service to patients from all around the world. And if you are looking for this type of solution, please don't hesitate to contact us, and we'd be happy to help you too.